Hey everybody, this is Mary here. I am doing an interview with my brother, Patrick Morgan.
Hello, people.
He recently had a stroke, and
Well, not that recently.
we're gonna ask him all the questions that you guys came up with. So, number one, what is your name?
My name is Patrick Morgan.
How old are you?
I am 35 years old.
Who are your family members?
My family are, my mother and father are Pat Sr. and Angel. And then I have a brother named Jonathan and three sisters, Mary, Maggie, and Christine.
How about your wife and kids?
I have a soon-to-be ex-wife named Aya. She's Japanese. And I have two kids, Patrick the third and Kyla.
And where do you work?
I work for TransCanada Pipelines.
Which is?
It is an energy infrastructure company, meaning we have power plants of all different types, and we have a lot of natural gas and pipeline, and then some oil pipelines, and some oil tank farm area where we store oil in Oklahoma. And we have all the different types of power plants spread out between U.S., Canada, and Mexico. So we're across 3 countries. I primarily work on I started working with the oil side of our company, but have moved over more on natural gas pipelines.
All right. Where were you when you first started noticing minor stroke symptoms?
I was in French Lick, Indiana at a work conference, and my stroke symptoms weren't mild. My stroke happened and my left side paralyzed, and I fell down, and then I realized something was probably wrong, but I didn't know what it was at first. So I just got to my hotel room and crawled in bed and attempted to sleep off whatever was causing me to not be able to walk.
Did you know? Oh, you already said you didn't know you were having a stroke.
I knew something was wrong, but because I couldn't fathom that potentially it's a stroke, even though prior to in my life I have had training and I know what a stroke symptoms are, especially now. At the time, I just figured I was too young to have anything major happening like that, so I kept kind of blowing off the potential that I should probably call 911 like most stroke patients do.
So after you had the big stroke and you were in the hospital, when you regained consciousness, what did it feel like?
It was very, very scary because I went from, I drove myself to the hospital eventually after my stroke because I had such a bad headache. I felt like I was dying just from the headache alone on my stroke. So I felt like I should get something checked out, and when I fell down I thought I had hurt my neck and paralyzed myself somehow. So first I went to a chiropractor and I asked him about it and seeing if he could adjust my neck or something so I could get my left arm and leg moving. He said I probably had a stroke, that I couldn't have pinched a nerve to paralyze half my body like that. So I drove myself to an emergency room. They did some scans and told me I had a stroke, and then ambulanced me to a bigger hospital that was more suited for stroke patients and that kind of situation. And once I got there, I got checked in. I had to spend the night and do my surgery the next morning for them to open up my skull and whatever they had to do in there. And they actually took a part of my skull out for a while to relieve pressure on my brain.
I suppose it's going to be hard to do in the car, but I'm going to quick move the camera so that you can get a better look, and then Patrick, point out what happened with your scalp.
So this whole section of skull right here was removed for a little over a month while I was at a subacute rehabilitation for stroke facility. And then I went back and they put my skull back in here and put some tabs in to hold it in place. so my bone can grow back together. And when I woke up from surgery, it looked like somebody had dented in the whole side of my head with a baseball bat because my skull was missing. And anytime I moved my head, I would get a bad headache. I'm not sure what that was about. Also, my whole face area right here was swollen up. My eyes were a little bit swollen and sore. And I was still just trying to understand what had happened. I just woke up and I was in a hospital and I had lots of staples and stitches across, because they cut my scalp open like this and then looped it up and around. And there's a bunch of pictures of what my head looked like when it was all cut up and my skull dented in. But
I'll
for
make
this
sure that
interview purposes, I'll just let Mary add that into the slideshow of stuff, because she was able to get down there right away and was there for me when I was getting up. I was actually extremely relieved when I first came out of my very first surgery, because my wife was there. And there's a kind of a sense of hopelessness and confusion when you wake up from it. And then doctors and their residents and nurses keep asking you if you can do stuff and kind of testing you. Right away you get tested a lot to see what kind of paralysis was caused by the stroke, or see what kind of stuff was damaged. And I had a right brain stroke, so I lost the ability to control my left arm and leg. And I had some facial and droopage on the left side, but that is now, through therapy and time, healed itself.
And let's look at that. So, like, okay, when I smile, you can see all my teeth are even. And when we have him smile, you can see that, like, the one side is right there.
Yeah,
it's a little
I'm still
bit
working
tough.
on getting that going at 100%. But I do a lot of exercises to try to get my smile back. And luckily my eyes are still good to go. I didn't lose any vision or hearing, but I do have what they call is left side neglect. I can see in the left, but sometimes I don't notice things in my left vision range unless it's moving or making noise. And I have to turn my head to try to use my right eye, because my left eye doesn't take snapshot pictures anymore of everything, if you will. It's kind of like taking a picture and everything on the left side didn't make it into the picture.
All right.
But I still see it, it just doesn't retain.
Another thing I'm gonna quick show you is the use of his arm. So we've got a little bit of a coat on.
We can't show the use of the arm because I can't use it.
So this is his hand, and
it's starting to, from muscle tone and other things, my fingers are starting to curl up. It just involuntarily does that, and depends on how I hold my hand, it'll do that.
But otherwise he has no motion at all. Like, if he lets it go,
it's just gonna hang out.
Just hangs down, doesn't do anything.
Sometimes it will shake, which is called clonus. It's a muscle spasm, and it's
kind of a fun party trick to have him.
There it is, right there.
So
when I move it, if somebody moves it or I move it, sometimes it'll just start shaking.
Yeah.
And that'll go on for a little while, and eventually if I move it or touch it, I can get it to stop. But I also get it in my left leg.
And you can kind of see his left knee right here.
I can kind of lift my leg up a little bit, but I don't have full control of my left quad muscle. So I can't walk without a brace on my leg. Or my leg will just buckle because I can't control the muscles to keep my leg straight without a brace.
So the next question is related to your therapy. So what kinds of therapies have you had to do since you had your stroke?
Well, right away you start with, some of the first therapy I had was speech therapy. And the focus of speech therapy is to help me get my muscle control in my face and my throat back. And because a lot of stroke patients, you lose all your control of muscle on the whole left side or right side. What they're worried about is that my muscles in my throat won't swallow food properly, and it could potentially go into the lungs. And then if you get food and things in your lung or water when you're eating, you can get aspiration pneumonia, which is really nasty. And then you have to get a trach tube. So to prevent that, they gave me puree food and liquids is all I could have until I had what they call as a video x-ray swallow. So they put a recorder and it x-rays my throat, and then they gave me pieces of food to swallow, and they watched it on camera just to make sure that I'm swallowing properly and it's going all the way down where it needs to. And once I passed that part of it, I was allowed to go back to normal food, and which was kind of nice because my first subacute, I was on puree food until I did that for a while. And puree food is basically just eating baby food, which kind of sucks because it's not very tasty when they blend your food to a puree.
How about, so
I also
that's
did
speech therapy.
Then I had occupational therapy, and occupational therapy helps you with normal tasks such as just getting dressed in the morning, and brushing my teeth, and things like that. They kind of help get me to do that, or show me little tricks to do it all with one hand. So I've learned to put socks and shoes on with one hand. Except for tying my shoes, they modified my shoes with a Velcro, so I don't have to try to learn to tie my shoe one-handed, but I guess it's possible if you look it up on YouTube. I just never got that far with it because I'm planning on getting control of my left arm back, so I don't have to worry about it. Also, occupational therapy did a lot of work with my left arm, trying to help it get moving. I did some electrical stimulation, and that helps the muscles move and contract. And the idea behind that is, as my arm moves, even though electrical stimulation is forcing it to kind of move, then my brain will get the signal that it's moving and start wiring itself back so I can control it. So I have to relearn or reteach my brain how to talk to my left arm and leg.
How
And also
about
there was
physical therapy?
And then physical therapy as well, and that's more focused on my left leg and things like that. They're also the ones that got me a kind of a cool leg brace that helps hold my knee back so that it won't buckle. And I had to kind of learn to walk with it, which kind of makes me look like and feel like I'm walking with a peg leg because it's a hard plastic shell around my leg on my left side that won't allow my knee to bend. That way I'm kind of stiff-legging it all the time, but I've learned how to walk that way.
All right, as of right now, let's go with, has anything major changed since you had your stroke?
Since my stroke, I'm much more easily distracted. Lots of things kind of can pop up and distract me and take me off course of what I'm working on or my thought process. I saw a car pull up a minute ago and some people get out in my right peripheral vision, and I keep looking over there because I heard something and saw something over there. Just little things like that can distract me pretty easily, and that's probably the biggest thing. But I've also had some medications that I wouldn't have probably needed or been on, so I take quite a bit of medicine.
So with comparison to before the stroke and now after the stroke, before the stroke, did you have any medications that you took?
I did not have to take any medications prior to my stroke, but now I take medicine to help me with anxiety, and I take Ritalin to help with focusing because I get so distracted. The Ritalin helps me stay on a little more focused. And then I got some blood pressure stuff, cholesterol, and
Blood thinners.
and then aspirin I take on a regular basis.
All right. Do the doctors think that you'll be able to make a full recovery?
Most of the doctors I've met and talked to do feel that I will make a full recovery of my left side.
How long will that take?
Depends. Everybody that has a stroke recovers differently. The time frames are different. But my progress is pretty outstanding, most of the doctors say, from where I was. And my ability to, my job lets me work from home or remotely. So also, I'll be able to return to work limited, just a couple hours a day. Right now they're saying 4 hours a day. But I'm not sure what the long term of that will end up being, because they're just going to give me certain tasks that I can do from home.
All right. What does your daily routine look like right now today?
Well, today woke up early because I had an appointment with TBI, traumatic brain injury, at the VA hospital. Originally, I wasn't going through the VA to help me with this stuff, but since I moved up here and away from the big hospital that I was originally getting a lot of stuff done at, and I'm a veteran, I spoke with the VA and they're going to start helping me. And they happen to have some really good people at the TBI clinic for traumatic brain injury, and they have all the therapists and therapy stuff I need. So that was the majority of the day, was going up there to my appointment. I got a ride from county and the drivers that help disabled veterans get to and from doctor appointments. And then my sister Mary came along or followed up there, and she's giving me a ride home. So that's my routine for today.
And how are you feeling today?
I'm feeling better than I have in a long time. And I also have a little Dramamine in me because since my stroke, I sometimes get car sickness. But it's been going away from it best I can. But I still take a Dramamine just in case sometimes, because I don't like to throw up. I don't think anybody does. So,
Do you know of anything that you could have done to prevent the stroke from happening?
I don't think I could have stopped my stroke in any way. So a lot of strokes are caused by people not being healthy with high blood pressure or high cholesterol, and clotting issues, getting clots in your legs, or DVT as they call it. But mine was caused because at some point in time in my life, I had a neck injury and dissected my carotid arteries, meaning that in between the layers of my artery and my neck, I got a little tear on the inside, and the blood, instead of going to my brain, started going into that tear and formed an occlusion. Then I went to a chiropractor in the morning. He adjusted my neck, and the occlusion started going up into my brain and eventually blocked blood flow. So I went back to that same chiropractor, like I said earlier, and he said I was having a stroke probably. So I drove myself to the emergency room, and then they couldn't help me, so they sent me to another hospital. And another interesting fact about stroke is most people that have strokes drive themselves to the emergency room. They don't end up calling 911. I'm not sure why. There's also some like a thing. The longer you wait to get to an medical help on a stroke, it adds time to the time frame of recovery. So the faster a person can get to the hospital, the better chance, or the faster that you can recover from it.
Alrighty, well that's all of our questions, and I hope that you guys were able to learn something from this video, and I think that's everything. So
thank you, everybody. Hopefully next time you guys ask me questions or video me, I'll be in better shape.
thanks, Patrick.
Thank you.
Smile.